So a friend of mine sent me this article in regards to Macy Gray, the singer, having to be taken to the ER due to her having some constipation and some stomach pain while taking Ozempic. So I wanted to talk about this because it is very common that we see things like this happen when people are on these medications, and I think it's something that we need to discuss. So let's get into it. So apparently Macy Gray, again, she was taken to the ER, and from my understanding and what I could find was they were suspecting that she may have developed pancreatitis in regards to taking the Ozempic. Now, pancreatitis is a possible risk when you are taking these medications, because when you're taking these medications, you have rapid weight loss, and sometimes with that, it puts you at risk of having things like pancreatitis. Now, that does not mean it's going to happen. It's just a risk. And one thing we do know, or we should all know, is that whenever you're taking any medication, there are risks. There's always risks when you're taking medications. There's always side effects. And unfortunately, pancreatitis is a risk that you take when you're taking these type of medications like Ozempic, Wegovy, Mounjaro, Zepbound, tirzepatide, semaglutide. That is the risk that you take. Just also, if you take Tylenol, when you take Tylenol over the counter, you're at risk of things like liver toxicity. So just keep that in mind. I'm not telling anybody this to alarm them or to frighten them. I'm just keeping it real, all the way real with you. But that is a risk, and that's something that you definitely want to discuss with your medical provider that's prescribing, so you're aware of that being a possibility. So I don't know if that's what they diagnosed Macy Gray with, because when you try to read up and find information, they didn't say that she had pancreatitis. They just said they suspected that that's what she developed in regards to her being on Ozempic. Another thing that they suspected was the constipation, which she had said that she had been dealing with some constipation. Now, with these medications, you are also at risk of constipation. Constipation, nausea, and vomiting is very common with these medications. Constipation, I hear a lot from my patients, and I think it's very important that you understand that if you are not going to having bowel movements regularly while on this medication, or you're going more than 3 to 4 days without having a bowel movement, you have to notify your medical provider. You notify your medical provider that's prescribing the medication, because you want them to put you on some type of bowel regimen to make sure that you're going to the bathroom. You also want to eat foods that's high in fiber. You definitely want to do that while on these medications. And another thing you want to do is stay well hydrated. Hydration is very important on these medications as well. If you could drink a gallon of water a day, that is amazing. If you can do half a gallon of water a day, that's great too. Some people can't do any of that. So what I usually tell people is, or my patients to do is, listen, we all have Stanley cups. So if you have a Stanley cup or some type of water bottle, you want to fill that up full and at least drink 2 of those a day. If you could drink 2 of those a day, you're going in the right direction, and then gradually start working your way up. But definitely make sure you're staying well hydrated. Make sure that you're staying on top of talking to your medical provider and letting them know if you're having any changes in your care while using these medications as well, because there's different things that they can do to make sure that they're staying on top of your treatment plan and making sure that you don't end up in situations where you have to go to the ER. So just keep that in mind. If you have any questions about these medications, you can go ahead and comment below, or you can also shoot me a DM, and I will be glad to answer them for you. Thank you.